Depression is a common and serious medical illness. It affects millions of people around the world, regardless of age, gender, or background. This condition can manifest in various ways, making it sometimes difficult to recognize. However, understanding its impact is crucial for providing the necessary support and treatment. It impacts how you feel, think, and behave. People with depression often experience persistent feelings of sadness, hopelessness, and a lack of interest in activities they once enjoyed. These emotional changes can be accompanied by physical symptoms such as fatigue, changes in appetite, and sleep disturbances. Depression can lead to a variety of emotional and physical problems. It can make it difficult to carry out day-to-day tasks, and can even lead to thoughts of self-harm or suicide. The weight of depression can feel overwhelming, but it is important to remember that help is available. It can also decrease your ability to function at work and at home. Many people with depression find it hard to concentrate, make decisions, or complete tasks. This can lead to decreased productivity and strained relationships with colleagues, friends, and family members. Depression is not a sign of weakness or a character flaw. It is a medical condition that requires understanding and treatment. Just like any other illness, it can affect anyone, and seeking help is a sign of strength, not weakness. It is a real illness with real causes. Fortunately, depression is treatable. There are various treatment options available, including therapy, medication, and lifestyle changes. With the right support, many people with depression can lead fulfilling lives. Most people with depression feel better with treatment. Therapy can provide a safe space to explore feelings and develop coping strategies, while medication can help to balance chemicals in the brain. Additionally, regular exercise, a healthy diet, and sufficient sleep can also play a significant role in managing symptoms. Depression is a global health concern. It does not discriminate and can affect anyone, anywhere. The stigma surrounding mental health issues often prevents people from seeking the help they need, which is why raising awareness is so important. The World Health Organization estimates that over 280 million people worldwide suffer from depression. This staggering number highlights the urgent need for better mental health resources and support systems globally. It is important to understand depression and its impact on individuals and society. By educating ourselves and others, we can create a more supportive environment for those affected by this condition. By raising awareness and promoting understanding, we can help break down the stigma surrounding mental health. This can encourage more people to seek help and support, leading to better outcomes for those struggling with depression. We can help break down the stigma surrounding mental health and encourage those who are struggling to seek help. Community support, open conversations, and accessible resources are key to making a difference. Encouraging those who are struggling to seek help is vital. Whether through professional treatment, support groups, or simply talking to a trusted friend or family member, reaching out is the first step towards recovery. Together, we can make a difference in the lives of those affected by depression. Depression is a complex illness with multiple contributing factors. One key factor lies within the intricate workings of the brain. The brain relies on a delicate balance of chemicals called neurotransmitters. These chemical messengers play a vital role in regulating mood, sleep, appetite, and other essential functions. In individuals with depression, there is often an imbalance in these neurotransmitters, particularly serotonin, norepinephrine, and dopamine. Serotonin is involved in mood regulation, sleep, and appetite. Norepinephrine affects attention, alertness, and stress responses. Dopamine plays a role in reward, motivation, and pleasure. Genetics also play a role in depression. Research suggests that individuals with a family history of depression may be more likely to develop the condition themselves. While genes alone do not determine whether or not someone will develop depression, they can influence an individual's susceptibility to the illness. It is believed that multiple genes interact with environmental factors to contribute to the development of depression. Further research is ongoing to identify specific genes and genetic variations associated with an increased risk of depression. Section 4. Life's Challenges. Environmental Triggers. Environmental factors can also contribute to the development of depression. These factors are often external and can be beyond an individual's control. They can range from the physical environment, such as living in a noisy or polluted area, to social environments like experiencing discrimination or social isolation. The impact of these factors can accumulate over time, leading to significant mental health challenges. Stressful life events such as the loss of a loved one, job loss, financial difficulties, or major life changes can act as significant triggers for depression. These events can create a sense of instability and uncertainty, which can be overwhelming for many individuals. The emotional toll of these experiences can be profound, leading to feelings of hopelessness and despair. Relationship problems, including conflicts with family members, friends, or romantic partners, can also trigger depression in some individuals. The stress of navigating complex interpersonal dynamics can lead to emotional exhaustion. Breakups or divorces in particular can be especially challenging, as they often involve a significant emotional investment and the need to adjust to a new way of life. Exposure to trauma, such as physical, emotional, or sexual abuse, can also increase the risk of developing depression. Trauma can leave deep psychological scars that affect an individual's ability to cope with stress. Chronic illness and chronic pain are other significant factors, as they can lead to a persistent state of discomfort and frustration, further exacerbating feelings of depression. Certain medications, particularly those with side effects that impact mood, can also be contributing factors. It's important for individuals to be aware of how their medications might affect their mental health and to discuss any concerns with their healthcare provider. Additionally, dealing with a serious illness or spending extended periods in a hospital setting can be incredibly stressful and can contribute to the development of depressive symptoms. It is important to note that environmental triggers can vary greatly from person to person. What may be a significant stressor for one individual may not have the same impact on another. This variability highlights the importance of understanding and recognizing the unique experiences and challenges that each person faces. Some individuals may have a higher resilience to stress due to various factors, including their genetic makeup, past experiences, and coping mechanisms. Others may find even minor stressors to be overwhelming. Recognizing and addressing these environmental triggers is crucial in providing effective support and interventions for those struggling with depression. Section 5. Recognizing the signs, symptoms of depression. Depression can manifest in various ways, affecting individuals differently. However, there are common signs and symptoms that can help identify the presence of this condition. One of the hallmark symptoms of depression is a persistent feeling of sadness, emptiness, or hopelessness. Individuals experiencing depression may also lose interest or pleasure in activities they once enjoyed. Changes in appetite or weight, sleep disturbances, fatigue, and difficulty concentrating are also common. Section 6. Diagnosis, criteria, and assessments. Diagnosing depression involves a comprehensive evaluation by a qualified healthcare professional. This process is crucial because depression can manifest in various ways, and its symptoms can overlap with other medical conditions. Therefore, a detailed and thorough assessment is necessary to ensure an accurate diagnosis. There is no single test to diagnose depression. Unlike some medical conditions that can be identified through blood tests or imaging, depression requires a more nuanced approach. This is because depression is a complex mental health disorder with a wide range of symptoms that can vary greatly from person to person. Instead, healthcare providers rely on several tools and assessments to make an accurate diagnosis. These tools help clinicians gather comprehensive information about the patient's mental health, lifestyle, and overall well-being. By using a combination of these tools, healthcare providers can develop a clearer picture of the patient's condition. One widely used tool is the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. The DSM-5 is a critical resource for mental health professionals, providing standardized criteria for the diagnosis of various mental health conditions, including depression. The DSM-5 outlines specific criteria such as the duration and severity of symptoms to help clinicians diagnose depression. For instance, it specifies that symptoms must be present for at least 2 weeks and must represent a change from previous functioning. Healthcare providers may also use questionnaires or rating scales to assess the severity of depressive symptoms. These tools can help quantify the patient's experience and provide a baseline for monitoring progress over time. Commonly used questionnaires include the Patient Health Questionnaire 9, PHQ-9, and the Beck Depression Inventory, BDI. A thorough medical history and physical examination are essential to rule out any underlying medical conditions that may be contributing to the symptoms. Conditions such as thyroid disorders, vitamin deficiencies, or neurological issues can sometimes mimic or exacerbate depressive symptoms. By conducting a comprehensive evaluation, Healthcare providers can ensure that they are addressing the root cause of the patient's distress. Section 7. Seeking help, treatment options and strategies. Treatment for depression typically involves a combination of approaches tailored to the individual's needs. Medications, such as antidepressants, can help alleviate depressive symptoms by restoring the balance of neurotransmitters in the brain. However, medication is not a one-size-fits-all solution, and finding the right medication and dosage may require trial and error. It is crucial to work closely with a healthcare professional to monitor medication effectiveness and manage any potential side effects.